Every 3 minutes, another senior in America receives a devastating dementia diagnosis. But what if I told you that the real culprit might not be genetics or inevitable aging? What if it's sitting in your bathroom cabinet right now, disguised as routine medication you take every single day? Recent scientific investigations have uncovered something truly alarming. There are common medications that millions of seniors trust and use daily that can actually accelerate cognitive decline and memory loss at a shocking rate. We're talking about drugs that your doctor may have prescribed years ago, medications you picked up at the pharmacy thinking they were completely safe, and pills you take without a second thought. The pharmaceutical companies have known about these risks for years, yet these drugs continue to be dispensed by the millions. Before we dive into these specific medications, I want you to pause for a moment and think about what you're currently taking. Do you really know what each pill is doing to your brain? Have you experienced unexplained forgetfulness, confusion, or mental fog that you chalked up to just getting older? Drop a comment below and let me know what medications you're on. I read every single comment and provide personalized insights that could literally save your cognitive health. Let's start with something almost everyone has used at some point. You know that little pink pill you take when you can't sleep or when allergies are driving you crazy? I'm talking about diphenhydramine, which most people know by its brand name, Benadryl. This medication is sold over the counter, which automatically makes most people assume it must be safe. After all, if it were dangerous, wouldn't it require a prescription? The reality is far more concerning than most realize. Diphenhydramine belongs to a class of drugs called anticholinergics. These medications work by blocking a crucial brain chemical called acetylcholine, which is absolutely essential for memory formation and cognitive function. Every time you take this medication, you're essentially putting a temporary block on one of your brain's most important communication systems. For younger people, this might not cause noticeable long-term issues, but for seniors whose brains are already producing less acetylcholine naturally, this interference can be catastrophic. Research published in recent years has shown that seniors who regularly use anticholinergic medications like diphenhydramine face a dramatically elevated risk of developing dementia. One comprehensive study tracking thousands of older adults found that consistent use of these drugs increased dementia risk by more than 50% compared to those who avoided them. Think about that for a moment. Something you can buy without a prescription at any corner store could be quietly eroding your memory and cognitive abilities. The insidious part is how subtle the damage can be. You don't wake up one morning and suddenly realize your brain isn't working. Instead, it happens gradually. You start forgetting where you put your keys more often. Names become harder to recall. Conversations become more difficult to follow. Most people attribute these changes to normal aging, never suspecting that their sleep aid or allergy medication could be the actual cause. If you're using anything labeled PM or nighttime formula, chances are it contains diphenhydramine. The safer alternative? Newer antihistamines like loratadine, which don't cross into the brain and won't impact your memory. Moving on to another incredibly common medication class that millions of seniors take daily without realizing the cognitive cost. Proton pump inhibitors, which you probably know as Prilosec or Nexium, are prescribed for heartburn, acid reflux, and stomach issues. These drugs are considered so safe and effective that some versions are now available over the counter. Many seniors have been taking them for years, even decades, because they work so well at controlling uncomfortable symptoms. But here's what your doctor probably didn't tell you when they wrote that prescription. By dramatically reducing stomach acid production, these medications interfere with your body's ability to absorb vitamin B12, which is absolutely critical for brain health and cognitive function. Vitamin B12 protects your nerve cells, supports memory formation, and helps maintain mental clarity. Without adequate B12, your brain literally begins to deteriorate. Large-scale research examining tens of thousands of seniors found that regular users of proton pump inhibitors had a substantially higher risk of developing dementia compared to people who never use these drugs. The mechanism goes beyond just B12 deficiency. These medications have also been shown to increase the accumulation of toxic proteins in the brain called amyloid beta plaques, which are a hallmark of Alzheimer's disease. So you're not just depleting essential nutrients, you're potentially accelerating the very disease process you want to avoid. The tragedy is that many people don't need to be on these medications long term. They were meant for short-term use, maybe 8 to 12 weeks, but patients stay on them for years because symptoms return when they stop. There are alternatives. H2 blockers like famotidine offer stomach acid control with less cognitive risk. Natural approaches like D-glycyrrhizinated licorice can soothe the stomach lining without the brain-damaging effects. If you've been on a proton pump inhibitor for more than a few months, it's time to have a serious conversation with your doctor about tapering off. Now let's talk about a class of medications that's been prescribed to millions for anxiety and sleep problems. Benzodiazepines, which include drugs like lorazepam, diazepam, and alprazolam, are some of the most commonly used psychiatric medications in seniors. When you're struggling with anxiety or insomnia, these drugs seem like a godsend. They calm the racing thoughts, quiet the panic, and help you finally get some sleep. The problem is that they come with a devastating long-term price. These medications work by enhancing GABA, which is the brain's natural calming chemical. While this creates immediate relief, prolonged use fundamentally changes how your brain functions. Major studies following thousands of seniors over multiple years have found that people who used benzodiazepines for more than 3 months faced a drastically increased risk of developing Alzheimer's disease, with some research showing the risk more than doubled. Long-acting versions like diazepam, which stay in your system longer, pose even greater danger because they accumulate in brain tissue over time. What happens is a gradual chemical sedation that slows down your entire nervous system. Your brain becomes less flexible, less capable of forming new memories, and less able to process information efficiently. Seniors on these medications often describe feeling disconnected from reality, like they're living in a fog. Their personalities change, they become emotionally flat, less engaged with life, and family members notice they're just not the same person anymore. The cruel irony is that when people try to stop taking these drugs, the withdrawal symptoms, anxiety, insomnia, and agitation can be so severe that they feel trapped. They believe they need the medication to function, when in reality the medication is destroying their cognitive abilities. If you're currently taking a benzodiazepine, please don't stop abruptly. That can actually be dangerous. Work with a knowledgeable physician to create a gradual tapering plan. There are safer alternatives like buspirone for anxiety, and cognitive behavioral therapy has been proven remarkably effective for both anxiety and insomnia without any cognitive damage. Let's shift to a medication class that might surprise you because it's often considered essential for heart health. Statins are among the most widely prescribed drugs in the world, especially for people over 60. They lower cholesterol and are credited with preventing heart attacks and strokes. Medications like simvastatin and atorvastatin are so common that some doctors believe everyone over a certain age should be taking them. But there's a dark side to these drugs that most patients never hear about. Here's the fundamental problem. Cholesterol isn't just something that clogs your arteries. It's an essential building block for your brain, which is composed of nearly 60% fat. Cholesterol plays a vital role in creating the myelin sheath, which is the protective coating around nerve cells that allows electrical signals to travel efficiently. When you aggressively lower cholesterol levels, particularly in older adults, you may be depriving the brain of a critical resource it needs to maintain cognitive function. Recent research has shown that seniors who have been on statins for several years, especially those on higher doses, show increased rates of mild cognitive impairment compared to those not taking these drugs. Some patients report sudden episodes where they can't remember familiar names, lose track of conversations mid-sentence, or forget how to get to places they've driven to hundreds of times. These aren't just annoying senior moments, they're signs of drug-induced cognitive impairment. It's important to understand that not all statins affect the brain equally. Some versions cross the blood-brain barrier more easily than others, which increases cognitive risk. If you've been on a statin for years and you're noticing memory problems, brain fog, or confusion, don't ignore these symptoms. Talk to your doctor about whether the dose could be reduced or whether you could switch to a version that's less likely to impact your brain. In some cases, particularly for very elderly patients who've never had a cardiac event, the risks of cognitive decline may actually outweigh the cardiovascular benefits. This is a conversation every senior needs to have with their healthcare provider. Finally, we need to talk about the single most dangerous factor contributing to medication-induced dementia, and it's something that's happening to seniors every single day without anyone noticing. I'm talking about what's called anticholinergic polypharmacy, which is the cumulative effect of taking multiple medications that all interfere with the same brain chemical, acetylcholine. Picture this scenario, which is incredibly common. A senior takes diphenhydramine to help with sleep. They're also on oxybutynin for bladder control issues. Their doctor prescribed amitriptyline for nerve pain. Each of these drugs individually has anticholinergic effects that can impair memory. But when you take them together, the effects don't just add up, they multiply. The cumulative burden on the brain becomes overwhelming. Massive research studies tracking hundreds of thousands of older adults have found that those with the highest anticholinergic burden from multiple medications had more than double the risk of developing dementia within 10 years. That's a staggering increase in risk, and the most heartbreaking part is that most of these seniors had absolutely no idea they were taking medications that interfered with their brain chemistry. Their doctors prescribed each medication individually without ever stepping back to look at the total picture. When you block acetylcholine from multiple directions simultaneously, your brain doesn't just slow down temporarily. Actual structural changes begin to occur. Neurons start to deteriorate from lack of stimulation. The connections between brain cells weaken and disappear. Memory centers shrink. The brain enters a state that closely mimics Alzheimer's disease, except this damage is often preventable and in many cases even reversible if caught early enough. The solution is surprisingly straightforward but requires action. You need a comprehensive medication review with your doctor or pharmacist. Ask them to evaluate every single thing you're taking, including prescription drugs, over-the-counter medications, and even supplements for anticholinergic effects. There are professional tools and online calculators that can determine your total anticholinergic burden. Once you identify the problematic medications, you can work on deprescribing, which means carefully and gradually removing unnecessary drugs from your regimen, switching to safer alternatives that don't affect acetylcholine, and rebalancing your overall medication load. Here's the incredibly hopeful part of this message. Unlike dementia caused by true Alzheimer's disease, drug-induced cognitive decline is often reversible. When the anticholinergic burden is reduced or eliminated, many seniors experience remarkable recovery. Within weeks or months, clarity returns, memory improves, energy comes back. The personality that seemed lost begins to reemerge. The brain is far more resilient than we give it credit for, but only if we stop poisoning it with unnecessary or harmful medications. This is why I'm so passionate about spreading this message. Polypharmacy, especially anticholinergic polypharmacy, represents one of the most preventable causes of cognitive decline in our aging population. Every senior watching this video, or